In speech station systems, we have the speech generating device software. Under the broad heading, we have the vocal voice assessment. Vocal voice assessment is a starting phase of any diagnostic patient. Whenever a patient comes to the clinic, the first aim should be to do the vocal assessment, which has many parables in it, like your complete database to be incorporated over here. So you have the whole history of the patient and a vocal assessment taking place. The vocal assessment goes on for about 5 seconds basically. Just a 5-second recording, even minimum of 4-second recording will definitely help to get the voice analysis, and we get about 26 parameters. Now you watch the screen how it happens. You have the patient registration where you have to register the patient, which will give the whole demography of the patient in question. This is a very important and a starting point for which you have the patient ID, you have the name, you have the gender, you have the age, you have the email ID, you have the insurance, and also the CPT code. CPT code means current procedural terminology. This is very useful for future insurance companies because this speech assessment, speech diagnostics and voice assessment is covered under insurance in several countries, and the insurance code number will also be there with the date of birth. So as you can see, you can also on the other side, the gray portion, you can record the number of patients and have the database of the patients that your clinic has been seeing or your branches have been seeing throughout the country. So here we go for a 5-second voice sample. So just watch, I'll be just saying 5 seconds a particular sound. So I have saved the sound for about 7.3 seconds, but 5-second sample is enough. You take the sample and you go into the various units there, and you will see that a report will be generated of about 26 parameters, a very vital 26 parameters that are necessary for a clinician to develop his clinical activity, like maximum fundamental frequency, minimum fundamental frequency, range, standard deviation, first format, second format, third format. We have the jitter, we have the shimmer. What is essentially required for a clinician is obviously shown on the screen within a duration of 5 seconds. This is known as the real-time voice analysis, which is very, very important for a clinical setup of any clinic or an institution or an organization. And this is also used for research purposes and various universities for students doing master degree, as well as for people who can even try to do PhD programs.